All right. Well, I guess it's 10:01 now, and I don't see anyone else in the waiting room, so we will go ahead and get started this morning. Thanks for joining us for our last Life at the Forest session. My name is Kelsey Fry. I work in the Department of Resident Life, and we want to thank the new Resident Orientation Committee for this program, and especially for their assistance as we transition to the virtual Zoom platform and making it a success. So we thank you to them. Before I turn it over to that committee, a few housekeeping reminders. The session is being recorded, so if you don't want to appear on the recording, you'll need to turn your camera off. It will be aired on channel 1390 this Thursday at 5:30. Due to the group size, we'll be holding all the questions until the end of the program. Just know, as many of you probably already do, you're muted upon entry, so if you have a question, you'll have to unmute yourself or feel free to type it in the chat bar, and I'll be going through and looking through the chat bar and trying to scan the gallery to make sure we've got everybody covered. So again, thank you for joining us, and I will turn it over to Ellen Barrett, the chair of the new Resident Orientation Committee.
Well, good morning, everybody. I'm welcoming you all from South Carolina today, where we have a family beach house, and I escaped from the forest at Duke for a couple of weeks. So life is good in South Carolina. I hope life is good in Durham. I just want to say thank you for everybody who's been attending so faithfully during the past 7 weeks. We've averaged well over 40 people. We've had an average of 36 check-ins, which means there are some people that are looking on as couples. So this is a fabulous response to this program, which is very gratifying to us and is very gratifying to the Resident Life Department. And I want to also thank Kelsey, and I want to thank Sandy and Megan for being excellent supporters on the technical side, and Daniel Langmeyer, who's on the committee, for his coordination in the background and doing all the sort of stuff that we need to do to make it look like it's running real smoothly. So if y'all have any feedback, suggestions, or anything like that, please email either me or Daniel. We welcome comments and suggestions so that we can try to improve what we've done this time for the spring session that is yet to be defined as to where it will be and whether it will be on Zoom. So today's speaker is Joan Nelson, and I hope y'all read her resume that was in the announcement of the Zoom call. Very impressive resume, Joan. And we're just glad that you 3.5 years ago decided to move down here with your family and husband and join us here at the Forest at Duke. You've been a real asset, and I know everybody's looking forward to hearing what you have to say today. We're sorry we will not have a video of the Health and Wellness Center because of COVID, and it's possible after COVID restrictions are lifted that we can go ahead and do that video and post it on channel 1390. At this point, that's not a promise, it's just a hope. So with that, I'm going to turn it over to Joan, and Joan is on a telephone, she says, so she can't see everybody, but we're up to 30 participants now, Joan, and it will grow. And so if you have questions, you use either the chat or raise your hand, and Kelsey and I will also try to keep an eye on things. Okay, turning it over to Joan.
Okay, so this is usually done in person, and it's usually pretty informal, followed by a tour. And as Ellen said, I apologize that we can't do that. When the restrictions are up, I would be more than happy to give anybody a personal tour without even doing the video. So we can make that happen when this is all over. Okay. So we normally do it that way. So I haven't done it in this format, so I'm going to do the best I can. I do have an outline, so I'll try to stick to it a little bit. The Forest at Duke, as you know, is called a CCRC. I'm from New York, so we don't have these there. We have individuals, freestanding assisted living, freestanding nursing homes, freestanding everything. So this to me was one of the greatest things about coming to work at the Forest. The fact that the staff and the residents, and we can have a social worker can have a day one relationship with somebody and then follow them through the continuum of care is really something that you don't realize what a great thing you have with CCRCs. So we are a continuing care retirement community. The levels of care that are listed in that go from independent living, which is our cottages and apartments, assisted living and memory support care, skilled nursing care with some memory support, and then we have hospice and palliative care, for end of life. So independent living, and when I'm done just quickly going over a CCRC, I'll go over our individual neighborhoods. So an independent living is really residents that need a little bit of assistance with doctor's appointments, medication, meals, ADLs. Did you guys functioning, driving, going, maybe you need a little help once in a while or just a little guidance. That's our independent living. You guys manage your own finances, your own households, and your ambulatory. So those are really the criteria for independent living. Assisted living is now you start requiring a little assistance with, and I'm sorry, I'm using the term ADL. ADL means activities of daily living. I'm also going to slow down. I forgot my New York is way coming out. Sorry. I will slow down. Activities of daily living are things like feeding, dressing, toileting, walking, eating, those kinds of things. So for assisted living residents, they're starting to need a little assistance, maybe with their meal prep and things like that. So in our assisted living communities, meals are provided, medication management is provided, and appointment management. Generally speaking, those are really the only things they need. That's why they've gone from the apartment and the cottages down to our assisted living neighborhoods. So they don't require a ton of help. Some of them still drive, still very independent, but are requiring a little bit of help. And then we have our skilled nursing, which, is nursing home care that you probably know of it as nursing home care. This is required licensed nursing skilled care. This is somebody has an absolute skill that they need somebody else to do for them with them. They have assistance with transferring, ambulating, toileting, and again, all of those ADLs. Also, there's 24-hour supervision and assistance by licensed and certified caregivers. So that is our highest level of care neighborhood. And then, of course, we have hospice and palliative care. This is really just end-of-life needs, comfort care, helping you refer for hospice, pain management, that kind of thing. So those are our neighborhoods, our breakdown of the levels of care at the Forest. Now, specific to the Forest, we have 3 facilities that are in our our skilled care. One is Olson. That's the Olson neighborhood. They're downstairs. There's 20 rooms there. These are for residents that require a significant amount of care. Physical, medical limitations. Some of them are bed-bound, total care, wound management, IV therapy, and tube feedings if necessary. So that is a high level of skilled nursing care. That's Olson. On Olson is also our 4 Medicare beds, which we'll touch on in a little bit. But right now, just the skilled nursing beds of Olson. Biltmore is the same level of care, but these are residents with end-stage dementia. So we have a secure unit where they can walk around without, the fear of them, getting lost or needing more help. Many of them are non-ambulatory. They have specialized feeding needs, cognitively impaired for sure, and some behavior problems and loss of verbal communication. That is an 8-bed unit. It's very small, very specialized. And that's on the Biltmore, also on level 0. The last of our skilled nursing is Holbrook, which is more of an intermediate level skilled care. These residents just may require help with their medication or with, they may require oxygen. They might have a complicated medication regime. So they too need help, but just not as much as the other two skilled nursing areas. Then our assisted living areas, the first, and I start with the first because it's a normal, or oftentimes somebody will go from an apartment or a cottage right to the Carlton. The Carlton are little apartments. They have a bedroom, living room, kitchen, and bathroom. These residents may or may not require assistance with their medication. They might need minimal assistance with, like somebody who needs standby showering. If they're in the shower, that somebody's around just to, in case they need help. Reminders about appointments or where they have to be. And they must be able to go to the dining room. So there's a dining room on Carlton, so they must be able to get themselves there for their 3 meals. These are residents that only require minimal assist, and they don't really have any kind of dementia or cognitive issues. This is really just for the resident that requires a little bit more help with their day. And that's the Carlton. After the Carlton downstairs, we have the Regency, which is 10 beds. And that is residents that have a little bit of cognitive loss. They may have some minor medical issues. They do not require the security of a locked unit, but they need a little bit of assistance with orienting them to day and time, what clothing to put on, how to get to the dining room. They could get lost easily, but are redirected. So that's our Regency. And then the last unit down there is the Riviera. Like the Regency is for residents that are more of an assisted living, but they have a higher level of cognitive loss. And sometimes maybe some behavior problems. So the Riviera is secure. There's a very decorative gate, but it is secure at the end of the day. So those residents, although come off frequently for activities and for getting out of there, they're only done that with somebody with them, a family member, a staff member, but that unit is secure. Those residents require a higher level of care, mostly because of their cognition. So those are our neighborhoods. Those are our all of our neighborhoods. And if you ever have questions about that, you can certainly ask me. Let me see. I'm sorry. I just want to look here. And okay. So the staff that would help you down here, the social work department, I am the social service manager, also a social worker, and Teresa is the other social worker. For those of you that don't know, we split up the entire campus. So now, again, I'm talking to you now based on pre-COVID, what we used to do. Things are a little different right now, and I'll tell you the difference. But normally, everywhere on the entire campus, if your last name starts with A to K, you have Teresa, and if it's from L to Z, you have me. And that means we follow you from your cottage to your apartment to your Carlton or to health and wellness, and we're your social worker the entire time you're here at the Forest. They used to do it a little differently, which is how they're doing it right now, which is I am the independent living social worker and Teresa is the health and wellness social worker. Do not like this nearly as much because there is that break that we don't have all the people that we would take care of straight through. Right now, this is how we're doing it to keep one of us up here and one of us downstairs and to keep things kind of COVID separate. It will go back to the way it was. And for the time being, if you guys are in independent living and you have a question or a concern that's not, emergent, and you want to start your relationship with Teresa and your A through K, feel free to reach out to her. But anything that requires like face-to-face or that you have to, see somebody, then you would come to me. And I am keeping Teresa abreast of everything that's going on with the IL, and she's doing the same for me with health and wellness. So A through K and L through Z, that's how that works. And that's just Teresa and I. We also have a third member of our department, and her name is Jessica Hackett. She's the resident navigator. I like that name. It's kind of fancy, but it does definitely tell what she does. Jessica's job is that she is the point person for navigating all levels of care for transition and adjustment. So if you were going from an apartment or a cottage to health and wellness, if you were coming in for a Medicare stay and going home, she also assists with departing one residence and entering the more supportive level of care. So she works with your family on how to vacate your apartment or cottage, how to, get your belongings where they need to go, what items can come downstairs and will fit, the adjustment of moving downstairs. There's some jokes around here that we want everybody down in health and wellness and that we come in the middle of the night and swoop in and take you away. That's not true. But once it is decided that you need health and wellness, we really only want it to be as smooth as possible. So Jessica plays a very large role in that, as well as your social worker. When you come down, Jessica will keep tabs on you for a little bit. Once she feels that you're settled or that your family is okay and they have no more questions, she will hand you off to your social worker, who's still involved, but she'll basically be done with her part of the process. Leanne likes to say she puts a bow on the process. So that's it. She basically gets it all nice and fixed, and then she goes about her other duties. So that's Jessica. And also where you would need to use Jessica, the role of the resident navigator. Let's say you are going for a hip replacement. Many of you will start out calling your social worker, which is a great idea. Even if some people will call me when they know it's like 2 months away, and we'll talk, and then I'll say, call me again when it's about 3 weeks away. So I put you in touch with Jessica. Jessica will come pre-COVID, would come to your apartment and talk to you. Now she'll talk to you on the phone, and she'll basically tell you what's going to happen, how the process works for you to come to health and wellness for your rehab, how many days you have, how it's covered. So Jessica will do that for a short-term stay. So that's another way where you would have contact with her while she's downstairs if you needed just a short-term stay. Okay, our social work offices are up by the clinic. Mine is on one side of the doors and Teresa's is on the other. You can leave notes for us, you can call us, you can leave messages, you can email. There's all kinds of ways to get in touch with us. And a lot of times IL residents, independent living residents, will say, well, what could I possibly, need you for now? I'm not living in health and wellness. There's a variety of things. I always tell you guys to come and once in a while, just pop in and let's check and make sure that all the information we have, the contact information, your advanced directive information, your anything like that, your family, that it's updated. Because anytime it changes, you have to tell me and I will put it upstairs and they'll change it in the computer. So just for that reason, just to start a relationship, there's quite a few things that we can help you with. Sometimes it's with insurance. Sometimes people have questions about their long-term health care. None of us down here are experts on that, but we can answer, some basic questions. Anything, you're just not happy. I mean, it's really that simple. If you just need somebody to talk to or to vent, or you really do feel like you're declining and maybe you want to start thinking about what's going to happen when you come to health and wellness, all different kinds of things like that. We get involved if somebody's driving and they maybe shouldn't be driving anymore. We do get involved in things like that. Certainly, we are here to listen. We are here to assist you. I'm sure there's other ways you can find to use us, and we're here for that as well. So that's the social work department. The clinic, so many of the residents here use the clinic as their primary, and probably just as many don't. We use both. They either use the clinic for their primary, they have a doctor outside. Now that we have the ability to use the Duke MyChart, it's making life a little easier for residents. Kelsey, did you have something?
Oh, no, sorry. Someone came
Okay.
to
That's okay. So some residents will maintain their doctors. You can also switch to the clinic and use your cardiologist, neurologist, pulmonologist, and they can still be your specialty doctors and then use the clinic. Having the clinic, it does make things easier in terms of having to go for appointments and things being right here on campus. Again, I know there's that stigma that then we know, everything, but it does work. And for some people, they'll know when the time comes when they should switch to the clinic. When you come to health and wellness, you don't have an option anymore. Our clinic becomes your primary medical team, okay? In the clinic right now, we do have a wonderful staff. I mean, we have just a great group of people. Lori is the clinic manager. You would call her if you needed, to get your prescriptions, or if you need to make an appointment, or if you needed transportation to a medical appointment. That's Lori. Birmo's the nurse in charge in there. We have Holly, who's a nurse practitioner, who's absolutely wonderful. And we have Dr. Bohr and Dr. Hanau. Those are the two physicians that are in there that take care of all of the residents in health and wellness, and many residents that are in the independent living side. The clinic is, like I said, very convenient. We also do, services that are for everybody when we have like the flu clinic and things like that. So there's always information coming out from the clinic. They are available to you. And they're also an urgent care. I'm going to call it urgent care. I'm going to do that, which I hate, but I'm going to do it. Because if you have an emergency, you do not have to worry about, let me get to my doctor, let me get out of here. You push that pendant and get our Respond team, and our clinic will, will help you in any way they can. The pendants, all right, so I'm going to be that person and say you really should wear your pendant. I get that IL residents don't want to wear them, but you should have it on your person at all times. If you fall in the parking lot, you can push it and somebody will be there. If you're, somewhere on campus, you can push it and somebody will be able to find you. It's nice to have that. That's one of the features of coming to a CCRC that you shouldn't neglect. And our nurses, we do have a Respond team. They will even, come to your apartment. So please utilize that. And that's the clinic. Our rehabilitation services, once you're in health and wellness, also in IL, is Legacy. Legacy provides PT, physical therapy, occupational therapy, and speech therapy. They also do, in a case by case, they could get somebody in for pulmonary therapy. So that is our therapy team. They see you either, if you're in independent living, they see you in your apartment, or they might even have you pre-COVID. They might even have you come down to they have a big gym where they would work with you. Right now, I believe we're really trying to keep it independent living being seen at home and health and wellness being seen down here. And our staff has been split up, such as the social workers, where some are up here and some are downstairs. And Legacy does provide outpatient, and also while you're down here. If you come down and use a Medicare bed, that's who would be providing your therapy. That being said, Medicare beds, this is generally the topic that is of most interest to residents that live in independent living. It's really one of the only things that applies to you right now. And the Medicare beds, we have 4 of them. I always get a question too that says, oh my God, there's only 4. What if I need it and you don't have one? I don't know why. I don't have the answer to this, but I'm here more than 3.5 years now. And only one time did a resident choose to go to another facility because we did not have a Medicare bed. So it is not a common occurrence. So we do have the 4 beds. What those are used for is for a short-term rehab stay. That is for someone that's been in the hospital. Generally speaking, you have to be in the hospital for 3 midnights to qualify for a Medicare bed. I understand there's some special circumstances now, but generally speaking, you have to be in the hospital for 3 midnights. Then you can come to the Medicare bed and your Medicare benefits will cover your stay. They cover your stay from day 0 to day 20, 100%. And from day 21 to 100, they cover 80%. And if you have another insurance, that could pay the 20. To stay in that bed for those 100 days, you have to meet criteria. So you have to be participating in the amount of therapy that you have to. You have to have a skilled need. There's reasons for you to stay in the bed. So you can't just stay in there for 100 days. You have to continuously be qualifying to stay. And our nurse here, Rachel, stays in touch with with Medicare, sending updates, how you're doing, and they, progressively let you stay in the bed for that amount of time. So the Medicare beds are used for many reasons, often knee replacements, hip replacements, shoulder surgery. Somebody was in the hospital and they just were in the hospital for a few days and are just, have left, they're just exhausted or they're physically compromised. Those are usually the reasons for the Medicare bed. They are a short-term bed, generally speaking. You get a heavy amount of rehab while you're in those beds. So some people say, well, what would be the benefit to coming down there instead of just going back to my apartment? My husband can help me. The amount of therapy that you get at home versus in a Medicare stay is significantly different. So you would get a very high level of rehab for, a short amount of time, trying to get you back home as soon as possible. Also false is that we get you in the Medicare bed and then we never let you go. Also false. We do not do that. We, and I say we, everybody here, all the team members want you to do your very, very best and get home as soon as possible. We have a care plan team that talks about when you're ready, what you'll need at home. Most people will leave the Medicare bed and still have rehab at home, but it's that scale down from the heavy level to having it in your house a couple days a week or whatever. But that is our goal, to get you back home, get you back comfortable. If you need, now again, I always say this, meals delivery used to be a thing for when you went home and you couldn't get to the dining room. Meal delivery now is the norm. So if things go back to normal and then you go home, we could get your meals delivered for a little bit. We have the names of some companions that could help you with household tasks. So we want to set you up for success at home. And that's the social worker's role and the care team. And we do that all together. The important thing that most people want to hear too is that the Medicare beds, we do not accept Medicare replacement programs. So if you don't have traditional Medicare, it is not covered through your Medicare replacement program. There's one that I believe we're establishing a contract with if we haven't already. And I couldn't get somebody to tell me this morning which one it is, but it's a Blue Cross Blue Shield. I just don't know which one. So that is something we can, follow up. If you have questions, we can follow up and find out which one that is. But for the most part, if you have a replacement plan, it would not cover your Medicare bed. The other kind of short-term stay down here is called a respite stay. So all residents that live at the Forest have 15, call them respite days, free days. You have 15 days where you can come down to Health and Wellness if you're just tired, or if you had, let's say you had pneumonia and you just feel like it's knocked the life out of you. You can come down here for up to 15 days and let someone else take care of you and just rest and get your strength back. Some people come over, if they're, just needing to just rest, or they hurt, let's say they sprain their ankle and it's not broken, but they just need to get off of it and get some help. They'll come down for that. So you have those 15 days, so it's nothing out of pocket. And then when you go home, let's say you stayed for 7 days, or let's say you stayed for 10 days. When you go back home, every month that you're home, you get one of those back. So if you use 10 days in 10 months, you'd be back to your 15. So you always have them. If you use them all, then you have to wait 15 months to get them all back again. You have them. There's no sense of, not using them. It is a good thing to do if you're not feeling well. If you were to move to Health and Wellness permanently, your first 15 days would be, those respite days would be used. So you do use them at some point, but don't be afraid to use them. Don't be afraid to come down. You know, I had someone the other day say, I've heard horror stories. You know, things have changed. Staff has changed. You know, things have changed about the facility. Please give it a chance, and go on your own experience. And also, you know, sometimes someone will say, oh, my friend told me that, you know, it was horrible when she went down there. Well, when did she stay down here? Oh, no, like 8 years ago. So we need, you know, we need you to give us a chance to take care of you. So there's that, the respite stay. And let me end before questions and answers by saying that, you know, you're social workers. So Teresa and I, you know, we work for you. We work at the Forest. But at the end of the day, our job description is that we are your advocates. Many of you have met me, have had the ability to know this about me, or have had some kind of a, you know, thing where I was involved. I work for you. I am your advocate. If you want something and maybe somebody else doesn't think it's the right thing, I'm going to advocate for what's in your best interest. And I will do everything I can to make that happen. You know, the hardest part of this job is when somebody has to give up their apartment, their cottage, their driving rights. It is a very hard thing, and it's a hard thing to come into grips with. But sometimes it is the best decision, and you know, the care team has to get on board and you know, do what's in your best interest. But you always have your social worker to help you, to advocate for you. There's really nothing I will not do for you. So please see me, come say hello, even just to say hi. You know, again, a lot of things have changed. We used to do, you know, kind of meetings things, but now that we're doing this, we're going to get through this, and we're always here for you. Okay. Do you guys have any questions?
We do have quite a few questions through the chat.
Okay.
So Pat Thompson is asking, when the new health and wellness center opens, how will the Forest determine which specific small house each resident will be assigned to?
The same way they do now. There is a team, there's a care team that just like meets people that are moving to the Forest for the first time. There's a team of people that meet with them to determine, you know, what is, you know, your physical needs, your mental needs, your, you know, how much help you need. And it would be determined on that. It is not an individual decision. It is always a team decision down here in health and wellness. And that's how we would do that.
Another question. Are social workers accepting face-to-face meetings at this time?
I am. So anybody, obviously L through Z, can come see me anytime. Teresa, at this time, if you're A through K, we're really trying to keep her separate. So the answer is no to that, but she's absolutely available by phone, and she's absolutely available by email. And she could even do, you know, a telehealth with you if you say to yourself, well, I don't want to get into a relationship with Joan if eventually I'm going to go back with Teresa. If it's not emergent and it's just you wanting to establish a relationship, we can even do, you know, a Zoom or a telehealth call where you can start that. But I am here, and I'm always over in the independent living side, you know, walking around and delivering meds and getting stuff for people from downstairs. So yes, the answer is yes for me, no for Teresa right now.
Would you say a few words about your role for those of us who have no close family, who have a banker or a lawyer as a contact?
Yeah, so the social worker, again, would really be your advocate. If you have bankers or lawyers, we would make, you know, touch base with them if you wanted us to. We make sure we have all that information. But if you require things that are just a little bit more, what's the word? More of a personal nature, more of a, you know, you need a person. You just need somebody to be there for you, support you emotionally. Whatever level of relationship that you guys are looking for, we're here to fill. We do have a few residents down in health and wellness that don't have anybody, and we have to be a little bit more involved there because there isn't a family, maybe in terms of, like getting them personal items or running out for them or things like that. For sure. We definitely want to make sure we have your proper information for your lawyers and your bankers, because that's important stuff too. But for anything else on the more human side or personal side, we would be more than willing to be your person.
How do laboratory services coordinate with Duke Hospital specialists?
I'm afraid I don't have that answer. Now that we have the Duke My Chart, everybody can see, the clinic doctors can see when you have tests and the results. So from that, I can tell you, if your specialist is a Duke doctor and they're in that system, you can go to your specialist and your doctor here can look on. There's also a lot of communication between our doctors and your specialists where they either are on Duke My Chart together or they're talking to each other. So there is a relationship. I don't know about if you use a doctor outside of the Duke system, how that works, but I hope that answers it a little bit. But we can always see your results, and your doctor here can communicate with your specialist.
Would long-term care insurance cover the costs of a Medicare bed?
No. Simple answer. Nope.
If a person has a hip replacement and has a Medicare Advantage plan, do I understand that a Medicare bed would not be available?
It would be available, but it wouldn't be covered. That's something that you could talk to Jessica, the resident navigator, about when you spoke to her about your upcoming hip replacement. She could speak to you about how that would work. There's also, if there are other facilities that do take them, and Jessica could also help you facilitate that. But to my knowledge, no, we don't take any of them, but this one potential that I don't know the name of. So no, the Medicare bed would not be for somebody that only had the Medicare Advantage plan or replacement plan, sorry.
Mm-hmm. I see one more through the chat, and then I see Ms. Juchinski has her hand raised. By Medicare replacement, do you mean ones like Humana Medicare?
Yes. Mm-hmm.
Ms. Juchinski?
Okay, I have a whole bunch of questions, but I'll just ask one. If one of our residents had to be hospitalized because of COVID and then got released from the hospital, do we have a place that's safe for the person and for the rest of our community when they leave the hospital?
Great question. So when I was talking before about all of our neighborhoods, the Riviera is that 8-bed facility with the gate. When COVID first hit, we emptied that out. We found other places in our facility for the residents living in there. Riviera is completely empty. It is an isolation unit. We've only had to use it once or twice for someone while we were waiting for results. We have not had to have anybody, in there because we've been very fortunate here at the Forest as a whole. But we do have a place. They would receive the care they need in a isolated setting and for everyone's protection. Yes, so we do have a place for that. Very good question.
One more through the chat. When will you know the name of the Medicare Advantage plan that I guess does qualify for the Medicare bed?
I just have to get up to Karen Henry. So if it's somebody that already lives here, if you want to just leave me a message, I can get that to you. But let me give everybody, if you're there, I'm just going to give you quick. My email is jnelson@forestduke.org. So you could certainly email me that you're looking for that information, and when I get it, I can send it out to you. Also, my phone number is 919-419-4073. Okay.
I don't see any more questions through the chat. Ms. Juchenski, did you have another question?
Sure. I mean, if nobody else is waiting in line, one of the things that has come up during the course of the discussion about the new health and wellness center that's being proposed is the assisted living accommodations. Many people were very impressed with the assisted living apartments that we offer that you referred to earlier. And that was one of the reasons they came here, and are a little concerned about the design for the small house, where each person's personal space is only sort of a one room and a bathroom. Is that cast in concrete, that plan, or is there additional consideration that might be given to it? A lot of residents have talked about this. That's
Yeah.
why I'm bringing it up.
Yeah. I will have to be honest with you. We've not had open discussions yet about those processes, other than the small houses. Many of our staff down here have gone to different places in the country to look at small houses. So other than that piece, we not really sure at this point if that is set in stone, if that's what they're going to do. But I'm sure there's going to be many more meetings that include Leanne Bailey Clayton and Anita Holt, that you could ask those questions. But for now, I don't know the answer to that. I really only know a lot about the small houses.
Well, I think that might be all the questions I'm seeing. All right, well,
Well, if so, Kelsey, maybe we're done.
sounds like it.
And I really thank you all again. And Joan, this was an incredibly informative session for us. There are a host of questions that we all have as independent living folks, I think, about really what goes on in health and wellness. It's kind of a mystery. And the social work department has also always been sort of a mystery. And I think you began to clarify a bunch of things for us. And I think it feels to me it's really up to us as independent living people to reach out to you in the social work department, because there are a whole bunch of us and there are only a few of you, and it's hard for you to get to really know us, but we can easily stop in as we're wandering around.
Sure.
Hopefully we can do more of that post-COVID, but no, it's a great service that is offered to us as independent living people, to have that sort of navigation through an illness or a hip replacement or whatever else happens. And it's just a nice feeling that that is here for us to take advantage of. So thank you for a great speech. And unless somebody else has a question, y'all are released from life at the forest.
You're welcome. You guys have a good one. Take care.
Thank you.
Okay.
Thanks everyone for joining.
Thank you.